Good day, I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. On behalf of Padma Clinic and Nursing Home, Chennai, as well as on behalf of Lions Club of Madras Excellence, District 324K Lions Clubs International, and as a part of the continuing medical education program, as well as the health awareness program for the public, today's topic is on one causative factor for loose motion or diarrhea, and that causative organism is a condition called as amoebiasis, and that is caused by Entamoeba histolytica, a bacteria. It is there in around 15% of Indian population. There are trophozoites and cysts. The cysts, they are the ones which produces the infection. These cysts, they remain viable in several days in the feces, water, sewage and the soil in the presence of moisture and low temperature. These cysts are not affected by chlorine, but they can only be killed if dry, heated to about 55 degrees Celsius, or they are frozen. Then they can actually be killed. The immediate source of infection is the feces, the motion of patients containing the cysts. Most individuals infected with Entamoeba histolytica, sometimes they remain symptom free. There won't be any diarrhea, nothing, but they will be carriers of it. These carriers can discharge up to lakhs of cysts almost every day. The transmission usually occurs through the intake of contaminated water or the food, or the contamination of the drinking water. Vegetables, especially if eaten raw without being cooked, you find, or a sewage polluted water, it is mixed, then you find this can actually produce a disease. Now, the other transmission is the cockroaches and rodents. They are capable of carrying the cysts and contaminating the food and the drinks. Now, the most important part is the food hygiene that has to be maintained if you want to prevent it. The protection, that is the food and the drink, has to be protected against fecal contamination. Uncooked vegetables and fruits can also be disinfected by thorough washing with detergents or in running water. Especially in running water, the vegetables or the fruits which you are going to eat, see that in running water they are washed very well. And the most important thing is, I told you there will be a lot of carriers. They have been having Entamoeba histolytica in their intestines, but you find they will not have any symptoms. They are only carriers. So that means the food handlers, they can be a very major transmitter of amoebiasis, and they should be periodically examined in hotels, restaurants, even in our own household, in the kitchen, when somebody comes and works, all those aspects, all those who are handling their food, they are the major transmitters of amoebiasis. They should be periodically examined, treated and educated in food hygiene, the most important being the hand washing, which is very, very important prior to cooking. And once one get an infection with amoeba, and you get the amoebiasis with loose stools, then the treatment of course, metronidazole, 30 milligram per kilogram body weight, to be given 3 doses after meals for about 8 to 10 days, or else now the better drug has come, tinidazole. So any one of these can in fact be given. So that's in brief on one of the causes. The causative organism is Entamoeba histolytica, a bacteria that produces loose stools or loose motion for certain individuals, and I have told you how it occurs, what is the mode of transmission, and how it can be prevented, and the importance of food hygiene. This is very, very important to prevent this. Thank you very much.